Hello, my name is Pierre, and I am a 2012 NLC alumni. Today's conversation is geared for current and future government, nonprofit, and social service public servants whose job or jobs will be to prepare for a world that will never be the same again. In March 2020, the world changed. A virus started spreading and no one knew what was going on. COVID-19 transmits when people breathe in air contaminated by droplets and small airborne particles. With over 109 million cases confirmed and 2.4 million lives that were taken, COVID-19 made its mark on the world. The Obama administration knew and told the Trump administration. All the experts are saying the US took way too long to shut down. Not only was the government unprepared, but hospitals were also unprepared as well. Hospitals didn't have enough supplies and respirators were scarce. If more public servants were trained and available, maybe we would have solved the problem much sooner. Just ask yourself, why did you become a public servant? Did you ever think you'd have to know about science, pandemics, and viruses? I have news for you. You will have to know about all that if you want to help. Threat-based resource allocation is something we pay for. If we are paying researchers at the CDC to look for things, why would we ignore them when they speak? Not only did we not listen to the CDC, we didn't listen to our allies as well. And that's why we are where we are today. It may be time to invite scientists in the war room. When you look at war rooms in the past, there usually aren't scientists there who are giving advice on how to deal with scientific threats. We may really need to rethink that. The government cannot help people if they do not have access to healthcare. So many people did not even make it to the emergency room because they didn't have health insurance and decided not to get help. Now more than ever, people will need to have healthcare because it's the airborne virus and no one is exempt from getting sick. Before COVID-19, underserved communities dealt with asthma and other breathing sicknesses from living in poor conditions. As public servants, we're going to have to reimagine how we spend our time helping vulnerable communities. The sooner we tell the people what is happening, the sooner they can prepare. Preparation is everything, and it's on us as public servants to make sure everyone is prepared early. Do you get the vaccine? Do you not get the vaccine? To be or not to be, that is the question. The vaccine question is something that every public servant will have to deal with for years to come. So all public servants need to make a decision. Bill Gates and others spent millions of dollars and donated their labs to help the public sector fight the pandemic. Now more than ever will we need the private sector to step up, donate money, and dedicate high-level staffs to the pandemic fight. No more cookie cutter feel-good jobs. There will be jobs in health policy that will be tech-driven. So in addition to learning health policy, you will need to learn how to communicate that information digitally. As public servants, our future public servants, are you willing to answer the call? The government will need all types of people from many different backgrounds to help with fighting the pandemic. Many jobs will be opening and they're going to need experts like us. The Biden administration just announced a $3.8 billion allocation for Northeast alone for testing and tracing. And there will be great opportunities for public servants, nonprofit leaders, and governments to apply for funding to help underserved communities. And if you're looking for the opportunity to get in the fight, the opportunity is right now. This mandate that the Biden administration put out will cause a trickle-down effect and create opportunities for budgets to flow through the healthcare industry in ways that it hasn't in decades. Let's say you're not into public health. Fundraising, if you're a fundraiser, we need you now. Fundraisers and research centers are going to need you. They're going to need you to come in and help raise money for us to make this happen. As public servants, we have to make sure that we are healthy first. But before we can help anyone else, we have to understand health and make sure we're healthy so we can help everybody else. Research and application. As public servants, we have to expand our thinking and be open-minded to venturing off into industries that we are not familiar with. Healthcare administrators, we need you, we need you, we need you. We need you to help us get research and development on down to the ground. Even if you aren't interested in healthcare, as a public servant, you should consider volunteering. You can volunteer at your local clinic, at the church, at the community center, senior centers, any place that has people. You should consider volunteering. Ladies and gentlemen, we are entering a new space. COVID-19 has changed everything. If you plan to be a public servant, you have to get involved in this fight. We need you now. Join this fight. Let's change the world together. Thank you.